Next presentation by Dr. Iva Rezic from University of Zagreb, Croatia. And the title of presentation is Recent Developments in Functionalization of Antibacterial Polymer Coatings.
So first of all, I would like to welcome you all. I would like also to thank the organizers for this wonderful opportunity to present our work. I would like to thank you all for coming and listening to our presentation, and I hope that you will find some inspiration for your work also. So we are coming from the University of Zagreb in Europe, in Croatia. And today you will hear some our developments in functionalization of antibacterial polymer coatings. So as you can see, we are trying to produce the polymer materials with different metals on their surfaces and coatings. Those coatings can have organic or inorganic materials as well as metals. But the most important thing is that we can achieve antimicrobial properties by using some materials. And sometimes when you're trying to find optimal conditions, it can be time and money consuming, and the result can be unpredictable. So in our work, it has been shown that mathematical modeling and acquisition of sophisticated statistical programs can really help us finding the optimal result. The main scope of our presentation and this work is to find new coatings that can be applied on different polymers. Our current focus are biodegradable polymers, and those materials are foreseen as medical materials which are active against different microorganisms. So what is the biggest problem and the biggest challenge of our society? If you are trying to see the classical application of antibiotics in hospitals, sometimes results in the problem that some microorganisms are becoming resistant to antibiotic treatments. And already in 2014, the World Health Organization has issued its first global report on antibiotic resistance, and the data that they have presented were coming from 140 countries. At that time, this problem was addressed as a serious and major world threat to public health. Today, due to COVID virus, many other people are coming to hospitals, and some of these problems of resistance are even more important. We have tried to summarize the countries that were taken into account during this World Health Organization investigation. And as you can see in this figure, there is also almost no country in the world that is not affected by these strange microorganisms called golden bacteria. The other problem is, if you are working with pharmaceutical industries, you will know that we have discovery void last 20 or 30 years because all new antibiotics that are developed are being preserved for the worst case scenario. So for now, we have antibiotics that we have, and we are trying to find other solutions that are not focused on this antimicrobial resistance. So given the fact that this serious threat health has been confirmed in all regions of the world, and during the fact that the World Health Organization calls for the implementation of infection control by preventing and developing new materials and procedures, we have focused on this problem and we are trying to find some solutions. And what is also important, there is correlation between the length of stay in hospitals and the number of deaths that are resulting from these problems. So I hope you can hear me clearly because we have some noise background. So in hospitals, there are many contact surfaces that are coming into contact with patients. Those are beddings, towels, sheets, bandages, catheters, and other equipment. And all of these can be really dangerous to human health if they are not sterile products. And especially dangerous are so-called superbacteria that are the focus of our work, as you will see. So, according to some predictions, by 2050, by those infections which are caused by an antibiotic-resistant bacteria, more people could die than from cancer. And only in Europe, 25,000 deaths per year and cost over 1.5 billion euros are associated with resistant microorganisms. And if you sum this number, you can see that this number is much higher than the sum of the deaths caused by AIDS, tuberculosis, and viral hepatitis together. So how can we find this problem? We are using nanoparticles, and all of you know that nanoparticles are such small materials that they are much smaller than the cells of microorganisms, so they can easily penetrate through the cell membranes and cause some effects. Recent investigations have proven that nanoparticles have the property of penetrating through the cell wall and also formation of pits and pores, which can lead at the end to the cell death of this harmful microorganism. So, our investigation is focused firstly on synthesis and characterization of nanoparticles, on antibacterial testing and characterization. The main procedure is now shown on this figure, and here you can see everything. So firstly, we have these polymers. They can be cellulose, man-made polymers, PLA polymers. You can produce fabrics or polymers that are crude, and we are putting them into solution of different solvents and metals, usually nanoparticles. Very important step is sonication that we proved, because if you want to produce homogeneous layer, then you need to follow this procedure. And after steering and sonication, we have drying of our samples, heating for 1 day, we need to put them on 100 degrees Celsius for 1 hour. Such modified materials are then investigated for their antimicrobial effects as well as characterize the different chemical methods. So the first step, as you could have seen, is this Sol-Gel procedure. Why do we use this procedure? We use it because it's simple, practical, and really cost effective. And the best result is homogeneous layer that can be applied on large surfaces. Second step is trying to investigate the metal nanoparticles that are present on the surface of such polymers. And what we have tried to do is trying to develop chromatography procedure in which we are testing 31 stationary phases and 19 mobile phases. Among stationary phases, we have tested cellulose, silica gel, polyamide, and aluminum oxide. And among mobile phases, we varied acetonitrile, acetylacetone, butanol, triethylamine, ethylene diamine tetrahydric acid, and hydrochloric acid with water and others. As for now, we have investigated 64 different metals. Afterwards, we also tried to produce the shapes of our polymer that we wanted to be planar or sometimes circular, and we are using 3D printing or additive technology in order to do so. So by this step, we can really make catheters, consumables, coatings, and some parts of bags that we want afterwards to functionalize. So we use this procedure so we can easily go from idea that was done in some computer program to object in several easy steps. For us chemists, it is very vital to know if we have managed to produce new chemical bondages. This we investigate with this ER spectroscopy, and we really know which parts of this spectra we need to observe before and after the modification. So as you can see, epoch groups can be determined around 900 centimeters, SEO groups around 1100 centimeters, metoxy groups around 2870 centimeters. And at the end, during characterization, a scanning electron microscopy equipped with ADX detector is very helpful too. Because firstly, we can make a microphotograph of magnification of 100,000 or whatever we need. The area along the surface of the polymer, And then we can produce this elementary analysis of this area and really see if our, for instance, silver nanoparticles of zinc oxide or any other are bonded to our surface polymer. Afterwards, we can make extraction and by chromatography detection see which type of element has been extracted from the surface and how efficient is actually our new coating. The least, but maybe the most important is also which kind of antibacterial effect have been we be able to produce, and this we do in different investigations. We use diffusion, microdilution methodology, and we have tried to develop time kill methodology. For these purposes, different formulations of different nanoparticles have been applied, and all tests for now were done in vitro. This focus of this work is focused on this methyl-resistant Staphylococcus aureus. This Staphylococcus aureus is this golden bacteria that is the goal of this investigation. So we have been able to have positive effects on Staphylococcus aureus, and we have seen the efficiency of such effects actually depends on which nanoparticle we use. First results that we did were preliminary results, and those show that the most efficient protection was noticed with silver and zinc nanoparticles. This was done on Staphylococcus aureus. It was a model organism in our laboratory. But afterwards, we really used this metal-resistant Staphylococcus aureus and found that small nanoparticles of silver with size of 10 nanometers are really efficient as well as zinc oxide. In contrary, titanium dioxide was not efficient against this microorganism. Afterwards, we tested some other oxides, which were also not efficient, but we tried to compare silver of different size, which was also as efficient as smaller silver nanoparticle. But what is really interesting is that we started also developing surfaces with platinum nanoparticles of only 4 nanometers, of different concentrations, and we were really able to produce interesting antimicrobial effects. So, what does this mean? That means that if we use some other microorganism, another method, we can see positive effect with different elements. And when we compare the results, what has been shown? So, zinc oxide of 100 nanoparticles show the highest antimicrobial activity on MSSR. Titanium dioxide was least active, but the most active among samples in regards to MRSA was silver nanoparticle of 10 nanometers, while the least active was again titanium dioxide. When we did this time kill methodology, when we wanted to see how many hours need to pass before we have really good antimicrobial effects, we have observed that after 6 hours of exposure, really good antibacterial effect occurs, which means that we have been able to produce surface which is excellent preventive medical materials, which can be used in hospitals for sheets and some textiles. So, to conclude, the results of this interdisciplinary study, which is actually the result of group from pharmacy, faculty, chemical engineering, faculty textile engineering, has shown that there are many different issues to be addressed in finding optimal nanotechnological medical solutions to deal with bacterial infections. Today, due to the COVID pandemic and huge increase in the number of hospitalized patients, demands for finding antimicrobial materials are also rising. And our study aims to answer several most prominent questions regarding the functionalization, preparation, and characterization of antimicrobial coatings active against Staphylococcus aureus, which included normal model Staphylococcus aureus, MSSA, and MRSA strains. It was shown that many metal oxide nanoparticles have antimicrobial effects in vitro, and that by 3D printing or this additive technology, we can produce any desired polymer carrier shape that we really need for medical purposes. The most prominent currently colloidal nanoparticle for medical materials are covalent silver nanoparticles, and in future, as you could have seen, platinum of really small sizes is under strong investigation. In addition, we are trying to develop chromatography methodology for simultaneous separation and determination of trace quantities. But since this is really just the first steps of our future investigation, also further research really needs to be included, and particularly as you could see, nanoparticles of smaller sizes such as platinum 4 nanometers. For the financing of our scientific project, we are very, very grateful to Croatian Science Foundation that is financing all the material costs and salaries of our doctoral students. So therefore, we have to mention that any findings, results, and conclusions which were presented here in this presentation are conclusions of the authors and do not necessarily represent the Croatian Science Foundation. At the end, I want to thank you for listening to this presentation, but also many thanks to all of my team, our co-workers that are coming from University of Zagreb, from different faculties. As you can see, there is Faculty of Textile Technology, Faculty of Pharmacy and Biomolecular Engineering, Faculty of Agriculture, and also we have some international collaborators. Without all those people, we could not have such nice results. So to all of them, I'm here now very grateful. Thank you for your listening. If you have any questions, you can ask me.
Yes, I have one question. Can you hear me?
Yes,
Jean-Marc
I can
Frances
see.
from Solvay. So I was very pleased to attend your presentation because it's very interesting. And also, I was wondering if you have tested against some corona type viruses, I would say, or cells, the zinc oxides, the titanium particles, and the nanoparticles that you have tested, and if you see the same effect on the coronaviruses.
Well, Professor Jean-Marc, thank you very much for your question. This is really important question. But as for now, we have only under investigation antimicrobial, znači microorganisms. But I have heard on one conference that some people are also have very positive effects against coronavirus, also with some nanoparticles. And you are right, zinc oxide and titanium dioxide are very, very strong candidates for this investigation. But in our laboratory, we did not establish methods for this. Maybe in future we will have to also. Yeah.
Thank you.
Thank you.